For more now on the Ebola outbreak, I spoke earlier with Dr. Anthony Fauci, the director of the National Institutes of Allergy and Infectious Diseases at the National Institutes of Health. I asked him what steps countries are taking to prevent patients from leaving the region and if fears of infection spreading outside of Africa are legitimate.
Let's take your question just from two different perspectives. First, the idea that someone might, in a West African country, get on a plane when they're feeling well but are infected, and then somehow get to the United States and then get sick when they're in the United States. Given the capabilities that we have to handle those kinds of infection, which is completely a different story than what we're seeing with the complete lack of healthcare capabilities in the Western African countries where there's the explosion of this epidemic, that we have the capability of handling this so that it won't spread. So people get concerned about that, and they really shouldn't, because of our healthcare system will allow us to do that. Now, getting back to the first part of your question, what kinds of precautions can you do? And one of the things is, first of all, we have, the CDC has just recently put in effect a level 3 travel alert, which means to go to those countries, you should only go if it's absolutely essential travel. When you talk about people coming from those countries, the airlines are now alert that, particularly in the countries in West Africa, where they're getting on the plane in West Africa, they're being questioned as to whether or not they feel sick, whether they have a fever or what have you. And if a person looks ill when they're getting on the plane, they're not allowed to get on the plane. And the airline personnel know that when they're actually coming to this country, if you have a sick person on board, particularly if it's coming from a Western African country, that you alert the CDC about that, and when the plane lands, that the proper approach gets to them, namely finding out, were they really in one of these countries, and do they need to be looked after and quarantined if necessary? So there's a lot of different ways that one can approach this and make it more safe on one end of the trip and on the other end of the trip.
As you look at the landscape, and we've talked about this outbreak now, I think a couple of times, at least once, this is something that just keeps going on and on and on. If you look at in your crystal ball, when do we see this thing getting corralled and actually handled, do you think?
Well, I don't think we can predict that for the following reason. The countries involved have such a real problem with healthcare infrastructure and organization and ability to handle infection control like this, superimposed upon just the social and societal climate in those countries, where people are mistrustful of the healthcare community, they're mistrustful of authority, of going into a hospital, they're fear, they're terror. It's understandable, it's not being critical of them, but they're really quite terrified of this. And to get this under control, you've got to get sick people, you've got to isolate them, you've got to have the people who take care of them have the proper protective equipment. And then when people die from this, you've got to handle the bodies in a very precise way. You can't have the traditional touching of the bodies by the family. You can't have people handle the bodies the way they normally do. That's going to be a tough nut to crack, because you have all of these things going on in a very populous area. So the way you shut down the epidemic is when everything comes into place and no one then spreads the infection to anyone else. It was relatively easy to do that when there were outbreaks in remote, small, rural areas. But the fact that this is now in very populous countries with porous borders that in fact now gets into the cities is making this even more problematic.
Dr. Anthony Fauci, always a delight talking to you. Thanks so much for joining us.